21. The nurse would question which medication order for a client with acute angled glaucoma. A. Atropine, saltropine, 1-2 drops in each eye now. B. Hydrochloride, dural 25 mg per daily. C. Propranolol, indral 20 mg per 2 times a day. D. Carbonylcholine, isoptocarbacal, eye drops, 1 drop 2 times a day. Correct answer, A. Question 22. A client tells you she has heard that glaucoma may be a hereditary problem and she is concerned about her adult children. What is the best response? A. There is no need for concern, glaucoma is not hereditary order. B. Screening for glaucoma should be included in an annual eye exam for everyone's over 50. C. There may be a genetic factor with glaucoma and your children over 30 years should be screened yearly. D. Are your grandchildren complaining of any eye problems? Glaucoma generally skips a generation. Correct answer, C. Question 23. What will be important to include in the nursing care for the client with angle closure glaucoma? A. Evaluation of medications to determine if any of them cause an increase in IOP as a side effect. B. Observation for an increase in loss of vision. It can be reversed if promptly identified. C. Control BP to decrease the client's potential loss of peripheral vision. D. Assessment for a level of discomfort. The client may experience considerable pain until the optic nerve atrophies. Correct answer, A. Question 24. A child is scheduled for a myomectomy. What goal of this procedure will the nurse discuss with the parents? A. Promote drainage from the ear. B. Irrigate the Astrakhan tube. C. Correct a malformation in the inner ear. D. Equalize pressure on the tympanic membrane. Correct answer, A. Question 25. After a client's eye has been anesthetized, what instructions will be important for the nurse to give the client? A. Do not watch TV for at least 1 day. B. Do not rub the eye for 15-20 minutes. C. Irrigate the eye every hour to prevent dryness. D. Wear sunglasses when in direct sunlight for the next 6 hours. Correct answer, B. Question 26. A child diagnosed with conjunctivitis. Which statement reflects that the child understood the nurse's teaching? A. It's okay for me to let my friends use my sunglasses while we are playing together. B. It's okay for me to softly rub my eye, as long as I use the back of my hand. C. I can pick the crusty stuff out of my eyelashes with my fingers when I wake up in the morning. D. I will use my own wash rag and towel while my eyes are sick. Correct answer, D. Question 27. What medication would the nurse anticipate giving a client with many ears disease? A. Nifedipine. B. Amoxicillin. C. Propranolol. D. Hydrochloride, hydrodural. Correct answer, D. Question 28. When teaching a family and a client about the use of a hearing aid, the nurse will base the teaching on what information regarding the hearing aid? A. Provides mechanical transmission for damaged part of the ear. B. Stimulates the neural network of the inner ear to amplify sound. C. Amplifies sound but does not improve the ability to hear. D. Tunes out extraneous noise in the lower frequency sound spectrum. Correct answer, C. Question 29. What statement by the client recovering from cataract surgery would indicate to the nurse need for additional teaching? A. I'll call if I have a significant amount of pain. B. I'll continue to take my Metamucil for another week. C. I'll just do some laundry this afternoon instead of going to work. D. I'll take my acetazolamide, Diamox, drops with my other morning medications. Correct answer, C. Question 30. A client is walking down the hall and begins to experience vertigo. What is the most important nursing action when this occurs? A. Have the client sit in a chair and lower his head. B. Administer meclizine, antivert, PO. C. Assist the client to sit or lie down. D. Assess if the occurrence is vertigo or dizziness. Correct answer, C. Question 31. Which client is at highest risk for retinal detachment? A. 4-year-old with amblyopia. B. 17 years/O who plays physical contact. C. 33 years/O with severe ptosis and diplopia. D. 72 years/O with nystagmus and Bell's palsy. Correct answer, B. Question 32. To promote and maintain safety for a client after a stapedectomy, what would be included in the nursing care plan? A. Implement 4 precautions. B. Prevent aspirations. C. Begin oxygen 2 to 4 liters per minute via nasal cannula. D. Change inner ear dressing when saturated. Correct answer, A. Question 33. The nurse would question the administration of which eye drop in a patient with increased ICP? A. Artificial tears. B. Betaxolol, Bitoptic. C. Acetazolamide, Diamox. D. Epinephrine HCl, Epurat. Correct answer, D. Question 34. A client is being admitted for problems with many ears disease. What is most important to the nurse to assess? A. Diet history. B. Screening hearing test. C. Effect on client's activities of daily living, ADLs. D. Frequency and severity. Correct answer, D. Question 35. A client calls the nurse regarding an accident that just occurred during which an unknown chemical was splashed in his eyes. What is the most important for the nurse to tell the client to do immediately? A. Rinse the eye with large amount of water or saline solution. B. Put a pad soaked in the sterile saline solution over the eye. C. Go to the closest emergency room. D. Have a coworker visually checks the eye for a foreign body. Correct answer, A. Question 36. A 25-year-old woman comes to the clinic complaining of dizziness, weakness and palpitations. What will be important for the nurse to initially evaluate when obtaining the health history? A. Activity and exercise patterns. B. Nutritional patterns. C. Family health status. D. Coping and stress tolerance. Correct answer, B. Question 37. A child with leukemia is being discharged after beginning chemotherapy. What instructions will the nurse include in the teaching plan for the parents of this child? A. Provide a diet low in protein and high in carbohydrates. B. Avoid fresh vegetables that are not cooked or peeled. C. Notify the MD if the child's temperature exceeds 101 F, 39 C. D. Increase the use of humidifiers throughout the house. Correct answer, B. Question 38. Which client is most likely to have iron deficiency anemia? A. A client with cancer receiving radiation therapy twice a week. B. A toddler whose primary nutritional intake is milk. C. A client with peptic ulcer who had surgery 6 weeks ago. D. A 15-year-old client in sickle cell crisis. Correct answer, B. Question 39. A client has an order for 1 unit of whole blood. What is a correct nursing action? A. Initiate an 4 with 5% dextrose in water, D5W, to maintain a patent access site. B. Initiate the transfusion within 30 minutes of receiving the blood. C. Monitor the client's vital signs for the first 5 minutes. D. Monitor VS every 2 hours during the transfusion. Correct answer, B. Question 40. The nurse is caring for a client who is receiving a blood transfusion. The transfusion was started 30 minutes ago at a rate of 100 milliliters per hour. The client begins to complain of low back pain and headache and is increasing restless. What is the first nursing action? A. Slow the infusion and evaluate the VS and client's history of transfusion reaction. B. Stop the transfusion. Disconnect the blood tubing and begin a primary infusion of normal saline solution. C. Stop the infusion of blood and begin infusion of NSS from the Y connector. D. Recheck the unit of blood for correct identification numbers and cross-match information.